I'm Dr. Lynette Wiest, and this video is about the thoughts and emotions that people experience when they or their loved one are diagnosed with a serious medical condition. Sometimes these thoughts and emotions can become overwhelming. Before thoughts and emotions become unmanageable, it is so important that they be given direct attention. Otherwise, they can progress to a point of creating further problems in addition to the issue that triggered the thoughts and emotions in the first place. So first, I'm going to share some signs or signals that indicate that emotions are needing direct attention. And then I'll explain how thoughts and emotions are connected. I'll give some possible reasons for the emotions, and I'll share some of the ways to manage these emotions. Now, as I describe the signs and signals of emotions that need direct attention, you may notice that some of these signs and signals can also be symptoms of health conditions such as thyroid problems, Parkinson's disease, allergies, anemia, infection, diabetes, heart problems, fibromyalgia, medication side effects, and more. So it is so important to be sure that you keep your health practitioners informed of all of your symptoms. Now, as I go along, I'll mention several topics for which you may want further information, and I'll direct you to videos and playlists on this video channel that will further address those topics. If you want to see those videos or previous or future videos, subscribe to the channel. And videos on this channel are about empowering purpose in every situation, about improving relationships, improving communication skills, uplifting the power of love, and more. So what are some of the signs that your emotions need direct attention so that you can prevent them from becoming a problem in and of themselves? A problem beyond the medical condition? Well, here are 10 signs, and I'm going to give you 10 signs and signals, and of course there are plenty more. So here are 10 of the signs that tend to be some of the more common ones. Feeling restless, excessive irritability or tension, feeling spacey or having foggy thinking, overwhelming sadness, a decreased interest in activities that you used to enjoy, an increase or decrease in weight or appetite, an inability to sleep or sleeping too much, feelings of worthlessness, and an inability to concentrate or make decisions, a loss of self-confidence, and uncontrollable worry. So these signs and others are messages from your body saying that something is wrong and the emotional pain must be addressed. And so you can learn to understand and de-escalate these emotions. So how does this work? Well, similar to physical pain, sometimes you know why you have the emotional pain, and sometimes you need to talk with someone to figure out where the emotion is coming from and what message it is sending to you so that you can know what to do about it. Now, think about physical pain, how physical pain sends you a message. For example, if you have pain in your bones, your body may be telling you that you have arthritis or bone cancer. If you fall and your ankle hurts, your body may be telling you that you sprained your ankle. But you have to use objective thinking and possibly professional advice in order to understand the pain and to decide how to address it. In a similar way, emotions tell us about our internal environment beyond the physical. For example, if you find out that you have a medical problem or that someone you love has a serious disease, then you will have emotions that tell you about your internal reaction. And it's normal to feel a variety of emotions like anger, sadness, fear, or confusion. Similarly, you may notice emotional relief if you find out about effective treatments for relieving a medical condition. If you are thinking, it is sad that I have a decline in the amount of control I have over my physical movement, then it's natural and normal to feel grief about the decline in physical control. It's normal to have emotions and not know why you're experiencing the emotion. And if this is the case, then you want to take the time to discover what's underlying your emotions. It might be obvious, or it could be that the emotion is built upon an accumulation of several existing emotions. For example, anger can manifest from a buildup of emotions such as fear, shame, disappointment, and other emotions. Our thoughts lead us to our emotions. For example, it's normal to think, I don't know what will happen to my body over the next couple years. And thinking this could bring about feelings of insecurity. Now, I'm going to explain a bit about how emotions, thoughts, and behaviors are interrelated. So thoughts set the emotion. So think of a thermometer and a thermostat. You set the thermostat and you read the thermometer. Thoughts are like the thermostat and emotions are like the thermometer. Thoughts and beliefs set the emotional temperature. Our thoughts create our emotions, and so it's important to choose thoughts wisely. Now, realize that emotions almost never tell us what to do to feel better. Emotions are not to be used to tell you what to do. It's important to remember that emotions, they tell us whether something is going wrong or going well or healing, but emotions do not tell us what to do or what is wrong or what is going well. It's important to use thoughts and not emotions to understand the situation. Then you want to choose responses and actions that are thought-driven and not emotionally driven. Behaviors and decisions that evolve from emotions alone tend to be reactive rather than intentional to your purposes and your goals. And if you act on emotions as though they can inform you of what to do, then you might do the opposite of what is best for you. For example, you might withdraw from the very people that are supportive to you. And sometimes thoughts about a problem can become more extreme than the actual situation. So thoughts that are too extreme for the situation are never the thoughts to act on. If you don't know if your thoughts are too extreme, then ask someone you trust. Extreme thoughts can create overwhelming emotions. And an example of an extreme thought is thinking, something awful will probably happen to me over the next few months, and so what's the point of doing anything anyway? If this is the thought, it could prompt you to emotions of hopelessness and helplessness. Now, it's normal to feel sad or stressed if you are faced with a health challenge or if someone you love is. These emotions signal to you what is happening inside of yourself. And when these emotions are used wisely, they prompt you to think about what actions may help, to think about it, to figure it out with your mind, what tentative plans to have, and how to plan ahead to solve potential issues that may come up in the future. Whatever your emotions are, it's important to talk to family, to trusted family, and to trusted friends about the emotions so that people know how to support you. If you struggle to communicate your feelings, or if you don't know how to, you can see the video on this channel titled Communicating Feelings. So when emotions feel like more than you can handle, then you can feel overwhelmed. And it's important to figure out what thoughts are bringing on these feelings. Examples of thoughts that bring on overwhelming feelings are, I am too much of a burden for others, or no one can help me, or I'm going to lose all my friends, or if people don't understand how I feel or what I'm going through, then they can't help me, or I'm less of a person than I used to be, or if I keep this a secret, it will go away. These thoughts, while not uncommon, can create overwhelming feelings of depression and anxiety. And if left unresolved, then these thoughts can lead to withdrawal and isolation from the very people who are needed for support. So if your emotions are overwhelming to you, then talk with a therapist or with someone who can help you understand where your emotions are originating from. Are they accurate to the situation, or are they made from extreme thoughts that do not match the situation? And you can look at the playlist on this channel called Emotional Intelligence. So it's important to learn ways to be more in control of your thoughts, your emotions, and your behaviors in the situation. Sometimes the problem causing depression or anxiety is coming from within a relationship. Now, relationships are constantly changing as each person in the relationship is constantly changing, and change can cause anxiety. So as you go through changes in your physical condition and other life conditions, it may be difficult for other people to understand some of the changes that you're making. People may want to give you advice that you don't want in your relationships, or you may get conflicting advice from people who care and want to help. So let people know what advice you want, what advice you don't want, and how you feel. The more that you communicate your thoughts, your emotions, and your choices, then the stronger your relationships will become. And for more about this, see the video titled Acceptance in Relationships. So if it seems like a family member is withdrawing from you, learn which areas of the relationship you can work on and which areas are outside of your control. And the same goes for your relationships with your friends, or the relationships with your coworkers, or the relationships with anybody. And for information about what is within your control in relationships and what is not, you can see the playlist titled Self-Care and Relationship Boundaries. So it can be difficult to accept some changes that people close to you make, whether the changes are due to health issues or other life transitions. And it can be difficult to know when to offer advice and when to give suggestions and when not to. Talking about thoughts and feelings can not only clear up this confusion and any anxiety, but it can also help the relationship become closer and more supportive. So be aware of your emotions as they're clues to you about your thoughts and about the situation that you're in. If emotions seem overwhelming, it may be that a change is necessary in the way that you're thinking about things, in the situation that you're in, or both. For more about this, see the playlist titled Beyond Sadness, Beyond Fear, Anxiety, Depression, and Anger. So be sure not to ignore your emotions, as they are healthy ways that your body is providing important information to you. Remember, there are some things that are within your control to change, and there are some things that are not. And it's important to know the difference so that you know where your power lies. You have power. You just have to know where it is. If you are unclear about what you can control, or about what may be a helpful change to make in your thoughts, or a change to make in your communication or in your relationships, then you can talk with a therapist or with someone who can help you make these decisions. If you liked this video, please click on the like button, comment in the space below, and subscribe to the channel. And share the video to help it reach out to more people who may benefit from seeing it. It is free to subscribe to this channel. Welcome, and thank you so much for your time.